India is the largest buyer of COVID vaccines in the world with 1.6 billion doses, according to a global analysis. Some scientists say could cover 800 million people, or 60% of our population. And this could even be enough to develop that elusive herd immunity, which we've been hearing about since the start of this pandemic. Now, a particular website, the Launch and Scale Speedometer analysis, which is updated every 2 weeks, shows that India has confirmed 1.6 billion doses of 3 vaccines as of 30th of November, while the US and EU have purchased doses of 6 candidates. There you can see in that graph there. Well, let's go back to Dr. Shekhar for more on that. And very interesting to know that we have already, booked or purchased this number of doses of the vaccine. And so hopefully once it comes, scientists claim that this number could even ensure that herd immunity that we all keep talking about.
See, for any country, it's natural that everyone is concerned about its own population. And therefore, if there is any kid on the block which can save the population, I mean, I'm sorry for using colloquial words, but any kind of treatment that is around the corner, then it's important that the country would evaluate it very carefully. And in this case, it would appear natural to me that India is looking very closely at the vaccine candidates. And indeed, it's laudable that government is actually pre-ordering the vaccines in anticipation that they would get approval from the regulatory authority. Now, more than herd immunity, it's important to break the chain of transmission.
Right.
When a virus transmits from one person to another, and suppose enough number of people have taken the vaccine shot, then you are naturally breaking that particular transmission chain. And that goes a long way in handling the pandemic, in getting it under control. That's what Indian government probably is looking at.
Right, and absolutely that, if we compare how much India has already booked and the US seems to be woefully behind. But there's the other issue as well, Doctor, of, rich countries buying up vaccines or booking the vaccines, and some, organizations that are, talking about this sort of equality in terms of vaccines have been raising this, that, the rich nations are hoarding vaccines more than their population.
Well, I don't think that's a worry, because what happens is most of the major vaccine manufacturers are in India. Our vaccine manufacturers export vaccines to all over the world. And that would not be a worry, at least as far as India is concerned. But even the past experience in the history suggests that whenever poorer nations have faced difficulties in acquiring medicines, Indian companies have been the major suppliers of those. And United Nations, WHO, all of them have acknowledged India's role in providing medicines even to the poorer countries. So I don't think that would be a case as what you're saying, that the vaccine would be only available to richer countries and perhaps not to the poorer countries.
Right, and India, of course, has an advantage because we're the largest vaccine producer, one of the largest vaccine manufacturers in the world.
That's right, absolutely right.
And so that is going to help us. That has helped us, in fact, in booking these vaccines. And the health ministry, when it during one of its press conferences, spoke about how they're not intending even to vaccinate the whole population. That was never the plan, but just a critical mass of people, and that's what you were talking about, to break that chain of transmission.
I think that must be the consideration, if I am right, because I'm not privy to the discussions that government has had. But
this was in a press conference, yes.
Yeah, but my gut feeling is what you're saying is right, that government is probably aiming at breaking the chain of transmission. And if we do that, I think we would have gained a significant control on the pandemic.
All right. Well, thank you so much, Dr. Shekhar Mande, for speaking to us here at NDTV.